New tonight, a Delaware County woman is warning others about what she wishes she knew before she bought her first home last year.
We're basically like new homeowners. We're 28 and we thought we were getting a good house and it turned out to not, and it'd be dangerous. So it's just sad.
Yeah, soon after Sarah moved into her Lewis Center home, she says she started getting sick with symptoms doctors couldn't explain.
Well, in a story you'll see only on 10 TV, Carla Rogner reports on how Sarah discovered the hidden danger lurking in her home.
Welcome in.
After years of house hunting,
Okay, so
Sara and Collin were excited to move into their first home.
we walked through the house. It actually was listed on Zillow as meticulously maintained, which is ironic because of the situation that we found later.
Soon that dream turned into a nightmare.
The first couple of days after moving in, I started getting sinus problems. It felt like a constant sinus infection for about 2 months, and then that slowly subsided, and then it turned into this eye rash problem that really sparked me to reach out for help.
The rash on her face was getting worse. Between visiting doctors, testing for allergies, and even changing up her skincare, Sara began posting to TikTok.
Whenever I leave my house, my eyelids improve.
Comments poured in telling her to get the house tested for mold.
And so I was like, Colin, we really need to get out of the house.
They brought in a dog trained to find mold, revealing what they couldn't see.
He found that spot. And then he found numerous spots up in our bedroom and our closet, along with our basement. It's covered in mold. And every single day I was working out in that basement an hour every single day. So my exposure was so high.
Results from an environmental test showed dangerous levels of mold in their house.
You can see the mold growth on the side here.
So now they're tearing apart their dream home. Dr. Karen Danamiller studies how home environments impact health.
We have strong evidence that exposure to mold growth in housing is associated with health impacts.
She says all homes can have some type of fungal growth, but too much moisture can create problems.
For mold exposure, the most reliable things that are associated with health outcomes are: do you see mold, do you smell mold, or is there water damage? And if you observe any of those things in your home, you definitely want to investigate a little bit more and see if you might have a bigger problem.
Sara and Collin say their home passed inspection with flying colors, and the previous owners did not declare any mold. The remediation is not covered by insurance and will cost these new homeowners thousands of dollars.
Here's where they're gonna do a zipper wall. There's negative air to conceal the spores in there.
In the meantime, they've been staying with relatives until they can safely move back in.
I'm just really hoping that the remediation does help, because I want to go back to living a normal life.
Yes, they are hoping that they can move back in soon, but they're also having to get rid of anything in their house that's porous. That's like the couches, the mattresses, anything that the mold could be contaminated in.
Pretty much anything. You
Yeah.
know, pretty much anything. Oh, that's terrible. What about Sarah's husband? Did he have any symptoms? Did he experience anything?
Yeah, so that's what's interesting. Her husband didn't have any of those health symptoms that Sara was experiencing, and we actually talked about that with the researcher over at OSU, and she says that's common, that mold issues can manifest differently in different people.
Wow.
Yeah.
Isn't that something? The wife had all those symptoms. Oh, my goodness. Well, they're going to do remediation, be able to stay in the home if they get rid of things.
Yeah, a lot of work to do.
Oh, the dream home that turned into a nightmare.
And insurance doesn't cover it. That's heartbreaking.
Yeah.
Yeah, it really is. All right. Thank you, Carla. Good story.